Okay, hi everybody. We're going to talk all about injuries and how to figure out what's going on with your body. I get this question a lot from different people whenever I get stopped from grocery shopping. It's a common way people stop me and they ask me questions about fitness and health and those sort of things. And people often, the most common thing that they ask me is about back pain, right? And it's a thing that a lot of people go through, and I thought it would deserve its own video, so here we are. So a little bit about anatomy and physiology of the back. So your spine, your body in general, it's a very intelligent system. Our bodies are very intelligent, and it's designed to protect us and keep us away from threats. A threat can be something as simple as stress, an injury, or maybe some sort of, if you have anxiety. These are all different forms of stress or different forms of threats to your body, and usually that manifests itself in different ways. And one of the ways it can manifest itself is through a musculoskeletal situation like an injury. So the most common thing that people get is because everybody's sitting at a desk and they're very sedentary, and if you're not aware of it, I'm sure as you know, that can put a lot of stress on the lower back. But here are a couple things that you can look out for to figure out what exactly is going on. So if you just started working out, you're just starting fitness, you're just getting into your routine, and you finally found the motivation to get up and to go do something about your fitness, and something happens, right? You hurt your back or you hurt your bicep, what have you. The one thing that I would ask clients, I would ask them, what kind of pain is it pain or is it discomfort? That's the first question. If it's pain, then you want to ask yourself, well, what kind of pain is it? Pain can be described in different ways. Pain can also be tolerated differently by different people, right? Because everyone has a different pain tolerance. So is it dull pain, achy pain, tingling, sharp? Those are the main ways. If you go to a physical therapist or a chiropractor, they will have you describe this pain, obviously. And those are the most common ways. Because when I ask somebody, if they ask me, oh, I have this back pain thing, how do I fix it? Then I ask them, well, what kind of pain is it? Then they look at me like a deer in the headlights and they're like, I don't know what you're asking me. So that's the way to describe the pain. Dull, achy, sharp, tingling, type of pain. Once you identify the type of pain, then you can narrow it down as to what's going on. Because if you're watching this, hopefully you're looking for some answers as to what's going on if you have an injury. Now, if it's a dull pain, it could be like a dull, achy pain. That's usually associated with a strain, which is a very, very minor injury. And that goes away with a couple weeks, doesn't really take much time. If it's a pull, it could also feel like a dull pain, depending on how it manifests in your body. Dull pain is like, it's like a heavy weight, like you feel like it's pulling you down when you are going about your business. And that usually is a pull. A pull, you're going to be limited on the range of motion that you can do. So if you pull, let's say your bicep or your tendon, or like not the tendon, but just the bicep, for example, you probably are not going to be able to flex it as hard, because again, you pulled it. Then there is a tear. A tear is when you literally tear the muscle off of the bone. And there's different grades of tears, just grade 1 through 3. 3 is completely off the bone. Tear grade 1 and 2 is minor, moderate, and then tear 3 is again completely off the bone. A tear, you usually know when you have a tear, because when you have a tear, you more than likely won't be able to move the joint and or the muscle. So that is very serious. More than likely, you know, if you're watching this video, I'm probably gonna just focus a little more on the back for now. For example, I'll take a disc herniation. People that say, oh, well, like, you know, they have back issues. Sometimes it's back, there's still a lot that's in the research that there's not much that still we know about the back. Because again, this can be very different for everybody. But the one thing I will say though is that you can do a simple test to figure out if it's a disc issue you got going on. So I'm going to show you here in a second what you can do. It's a simple flexion extension of the spine, and you have all these discs in place. And if you herniate a disc, what happens is the disc pops out of the spine and it starts pushing at a nerve. And this nerve, let's pretend this orange thing is the nerve. It pushes on the nerve and the nerve starts to spaz, like it starts to trigger other parts of the body, and you might feel like a form of electricity shock. If you feel that right now, you're in pain, it's more than likely a disc issue. But those, they reabsorb with time, the disc in the spine. You just have to give it its time, and you can't force it. It will reabsorb. You can get a cortisone shot. That's one way. But you know, not a huge fan of that, but that's one way to kind of fix that. It doesn't even have to be like a disc herniation. It can even be something like scoliosis or kyphosis. Scoliosis is where your spine starts to turn like almost like into an S, and kyphosis is when your back is excessively like rounded forward. Those can be rehabbed with therapy and consistency, right? Now, I'm going to show you very quickly a simple exercise that you can do to figure out if you have a disc issue. Before I showed you, I'm not a doctor, so go follow what your doctor tells you. Okay, I've been around the block. I've worked with a lot of different doctors in physical therapy and chiropractic. And so I know a couple things. So, hands behind your back, you're going to lift. If you go to a physical therapist, they're more than likely going to have you do this. You're going to put your hands behind your back, you're going to round your back, and you're going to lift one leg up, and you're going to look down. You're going to bring your knee towards you, keeping your head down, and extend. So down, extend, down, extend. Another thing that you can do is you can look down, keep your leg up, and look up. So extend your leg, down and up, down, up. If you feel pain doing this, it's probably a disc issue. But they have you, this is actually technically a way that they would probably prescribe you therapy. And this is one thing that they'll have you do to work at the site of the nerve. Okay, so a couple of tips to rehab and to address injuries. And again, I'm not a doctor, so you talk to your doctor. Okay, this is YouTube. And I've been around this industry for a good amount of time, so you know, I know a couple things. So a couple things that you can do to address injuries, to figure out what's going on is, number one, go see a doctor. You can go see a physical therapist or chiropractor. That's usually the person you go to for a musculoskeletal injury, or a sports medicine doctor. Do not go to your medical doctor. Do not go to your internal medicine doctor, because they don't know what's going on with you, unless you suspect, you feel like it's an organ. Then yeah, you need to go see your medical doctor, your internal medicine doctor. But assuming that it's not that, then you can go again to your PT and chiropractor or sports. I prefer to go to the sports med doctor, because sports medicine doctors can do ultrasounds. They can order the MRI. Physical therapists can too, I think now. But in my opinion, I think sports medicine doctor may offer you a little bit more than a PT. Now, here are a couple things that you can do if your doctor doesn't tell you. You can look into what's called peptide therapy. You can ask them for a peptide therapy. This is a very fine line, and not a lot of doctors agree with it. Not a lot of doctors practice it, and not a lot of doctors are educated on this topic. So tread carefully on who you ask and who your doctor is. But peptide therapy, you can look into and using what's called BPC, or BPC 157/TB500. Very common in sports world. So you can do your research on that. But it works, at least so it seems. But again, these are kind of still in the loop of things. I think they're still in trials to see if it's going to be used in therapy and helping with injuries. The second thing that you can do is obviously your physical therapy and your rehab. So if you don't know anything about rehab is basically a very light form of exercise. And then when you do your rehab, assuming it's around a back injury or a back situation, you want to focus on a lot of trunk. Trunk is basically below your chest and above your hips. The mid part of your body is your trunk. You want to focus a lot on strengthening this area in 3 ways. Kind of a sit-up position, a lateral position like a side plank, and then rotation exercises like a side plank with a rotation or a paddle-off press. Another way to fix an injury or to address the injury is to look into superficial topical ointments or topical products like Biofreeze or Bengay. They're made out of menthol, and I don't personally like it too much, but that's something that you can try too. Last way to deal with an injury or how to address the injury is, of course, time. If you go to a PT and a chiropractic doctor, they're going to tell you it's going to take time, and that's nothing short of the truth. You have to give it time. It just heals on its own. The body will heal on its own. Now you may be asking, well, what if it doesn't? Can I take antibiotics? No, don't do that. Try to look to natural roots. Now, if you're in a serious situation, then your doctor recommends an antibiotic, then obviously, again, I'm not a doctor. Do what your doctor says. I'm just saying that there are different ways to address different situations. You don't always have to turn to drugs and to medicine, okay? Something like cortisone shots, you can maybe look into cortisone shots for arthritis, for example. You can look into maybe getting some more turmeric in your diet, more anti-inflammatory foods into your routine. Turmeric is a great one. It's turmeric with black pepper, coconut oil. You whisk it together, you put that in your mouth, you eat it. That has a lot of anti-inflammatory properties in it that may help with arthritis or with osteoporosis. You can also look into different herbs that can help address this. So there's just different things out there that can help you. Turmeric is by far probably my favorite. And last tip on how to deal with injuries and how to fix it and address them is to have a positive attitude and to be optimistic. To be careful that who you're around, and if anybody tells you it's not ever going to get better, that you're never going to be able to do X, Y, Z again, like a doctor that tells you, because unfortunately a lot of doctors are telling their patients that, oh, you'll never be able to walk again. It's like, Jesus, I have you here to make me feel better, not to make me feel worse, right? But I believe in having a positive attitude and being optimistic and expecting nothing but the best out of the situation. And I believe that things always will get better if you have that positive attitude. So if your doctor tells you can't do this, you can't do that, it's your job to prove them wrong, because miracles, nothing is really impossible in this awesome universe. I mean, there's awesome, amazing things going on. People that are so close-minded and think that, oh, it's impossible. It's your job to prove them wrong, so you got to do your part in making sure that you can do everything you can to make that injury go away and to make your situation better. Okay, so those are my tips on pain and injuries and bad situations. I think the key thing, main takeaway from this video is the power of your mind. Also, when you have an injury or you have a very sad situation, you can do other things. Use it as an opportunity to do other things. So if you herniated a disc, you can do a lot of bicep curls. If you, I don't know, tripped and you sprained your ankle, you can work on toe exercises at home. You can find something else to keep your mind on so that you're not dreading the fact that you're in a situation that's not the best. So something that I know I always keep in the back of my mind is that your attitude is everything, especially when you're in a vulnerable situation. Before I end the video, I would like to add that usually if something like an injury happens, a little bit about the signs behind it. You can be asymptomatic with an injury, and what that means is you don't experience symptoms of the injury, and surprise, you have an injury because you're in your vulnerable position at a vulnerable point in your life, and you were stressed out, and all of a sudden now you have this, you know, whatever disease or injury or whatever, and it manifests itself at a point in your life when you feel like it shouldn't, but it is because you're stressed out. This is why it's so important to manage your stress effectively and to try to stay calm during difficult times. Although that's so hard to do, you can do it, and it's possible only if you know how to do it. And the fortunate truth is that a lot of people don't know how to do it. But that's just a little bit about injuries. Technically, the injury that you are experiencing or whatever, it was already there, but it's just that in that point in time, it revealed itself through something that you did, or maybe you're going through something very difficult, and thus the injury is presenting itself because again, you're in a vulnerable moment in your life. So knowing that, can the injury or will the injury ever really go away? My contention is that it doesn't really go away. The symptoms just go away, and you learn how to what's called damage control, right? You learn how to manage the pain. It's not to say that it will be there forever, but what I will say though is that it will still be there, and it can restrict other things. And that is just part of life. Things, nothing is going to be perfect. Our bodies are not perfect, but we can do what we can to prevent it from flaring up and prevent it from hurting us and preventing us from doing the things that we enjoy. Okay? All right. So hopefully that was useful and helpful. If you did enjoy this video, consider liking the video and check out my Instagram and subscribe to the channel for more, and leave a comment below any questions that you may have. And for programs, you can email me or message me. I'll see you in the next video.